All right, it is 12:30 and a good afternoon to you. Brian Dust, how's it going, man?
We're doing good here on a good old Wednesday.
Oh, yeah, Wednesdays are awesome, I guess.
Nice weather.
Anyway, it's always awesome when April Ritz
Ah,
shows up here.
indeed.
Got your Facebook Live going here. You can come check her out on there. You can listen to her on the radio. We're going to talk about health because it's all-encompassing health. You can make us all healthy, right?
Yep, we're going to talk primarily on women's health today. So
All right.
perimenopause, menopause, that type of health.
That fun stuff.
Yes.
All right, so we've probably all heard about it, menopause. Most men don't understand it. They don't have a clue.
They think their wives might be going crazy.
Something like that. I don't know. Well, anyway, tell us a little bit about it and how we can learn to deal with it better and all that stuff.
Yes.
That's what we need to know.
Yeah, so Dr. April here with Effingham Pelvic Health and Wellness. We are a pelvic floor physical therapy clinic that specializes in pelvic abdominal pain, obstetric care for men, women, and children. But women is a large percentage of the population we treat because they are just known to have more pelvic floor issues.
Yes.
So we treat anything abdominal pelvic pain from painful periods to pain with during menopause, childbearing issues. Some patients this morning, some vulvar irritation, bladder issues, lack of urgency, for kiddos, for like knowing when to have to go to the bathroom. So we see a wide variety of things, but we have a class coming up called The Change from Perimenopause to Menopause. We have one class coming up on March 26th at my clinic.
Okay.
And then we have one on May 1st at Casey Coffee Company.
Okay.
And these classes often sell out. The last one we did at Casey Coffee Company completely sold out. It was packed house. So I just really want to get on today and to talk about menopause and a little bit about that class and what our clinic does to help with menopause.
This would be very interesting, and a lot of people, like you say, it's one of those. Back in the days, we never talked about that. It just they're going through the change, and all this stuff. Now we're getting lots more information. How to make it a better and pleasurable, more experience, right?
Yeah, so there's so many different symptoms that can go with menopause. Our clinic really focuses on the genitourinary symptoms of menopause, which could be like for genital symptoms like vaginal dryness, burning, itching, irritation, or bleeding. Urinary symptoms would be like pain with urination or after urination, urinary frequency, having to pee a lot, and a lot would be peeing more than every 2 hours is considered a lot.
I see this dysuria.
Dysuria. That's
what is that?
I was going to not say that. That's the pain. That's a painful urination.
Painful.
Yes.
It's not a good thing.
Painful urination.
Who came up? Wait a minute. Who came up with this name, dysuria? What's that?
So urea, urine.
Yeah.
Okay.
And then I think dys is, I guess, pain. I don't know.
Bad. I don't know.
Die. It feels like you're going to die.
Yeah.
Okay.
Yes, I think dys would be pain because like dyspareunia is pain with intercourse.
Gotcha.
So that's another symptom of genitourinary symptoms of menopause is pain with sexual intimacy or other sexual dysfunctions. And then another one that we see commonly in the clinic that doesn't always have to deal with this menopause time frame is recurrent UTIs.
Oh, yeah.
So we go into detail with all of these issues with our patients try to get to the underlying root cause, which if they're coming in and they're in that time frame of when they're having other symptoms that are potentially perimenopause, menopause, the reduction in estrogen, the gold standard to treat this really is pelvic floor physical therapy plus a vaginal local estrogen cream to that tissue. A lot of people get scared when they hear of like using estrogen.
Yeah.
But this is not like an oral pill that's going systemic because there is research on that linked with some cancers.
Okay.
So we have to be careful.
We definitely
with that.
don't want that.
Yeah. So vaginal estrogen, though, there is no research showing that it goes systemic and contributes to these cancers. So we recommend pelvic floor physical therapy at our clinic, and then I'll talk to their provider and see if their provider is on board with getting a vaginal estrogen cream to help there's a lot of estrogen receptors down in the pelvic floor region to help with healing. That can help with some itching, the recurrent UTIs. There's so many different causes of pelvic floor irritation, but one of those in this time frame, which for most women is around 45 to 55 in that age range, could benefit from some estrogen cream.
Yeah, you mentioned something that over the years, you just hear more and more of that, and that's that recurrent UTIs.
Yeah.
And it's like, man, that's just become something for all ages, maybe more towards, older folks or whoever. But if you've got something that can help that alone is a huge issue out there, it seems like. It's
It
like, wow, what can you do?
it really is, and I actually see a lot of recurrent UTIs in children.
Oh, is that
Oh.
right?
So I do pediatrics, and I see a
Ah.
lot of kids who have recurrent UTIs as well.
What
Yeah.
what kind of causes that in for
kids?
children? Yeah.
And kids, often it is constipation and stool withholding. So if you
Okay.
think about
Yeah.
if they're holding their stool in for so long, that
Mhm.
bacteria,
Oh,
and if they're
yeah.
having smearing and stuff, that can creep up into that urethra
Yep.
and cause some of those infections, or improper wiping
Okay.
in kids
Sure.
too.
Which makes sense.
Yeah. So, but yeah, so recurrent infections, I often will talk to patients too about there's a couple supplements like D-mannose or Elura is a new one out there that's a really good product too. I talk to the providers too about maybe getting on a supplement to help with those recurrent infections, plus like the vaginal estrogen, and then addressing any pelvic floor tension. So a lot of our patients that are coming in with this pain also have pelvic floor tension, where their muscles are not actually it's not a weakness issue, it's that they're too tight.
Mm-hmm. It's
Oh.
the opposite.
Yeah.
Yeah.
Which is something we've learned with you over these years now. That's a big problem. Sometimes it's maybe more of your too tight in that area
Yes.
instead of you
Too weak.
you need the best of both worlds down there.
So yeah, if you're listening, don't just do Kegels. Try to fix your pelvic floor issues.
Mhm.
There you
Go
go.
see a specialist.
That's right.
Come see us.
Yes, those are a good thing. All right, it's nice to come in and see you at your office, but these classes you put on, I think, are very informative, and I think people really enjoy them.
Yes, that's our goal, and we've been doing them for a while now. And so the perimenopause the perimenopause and menopause class, I teach that with Tiffany Mosley, and she's an advanced practice nurse, and she does a lot of hormone care.
Okay.
So in our class, we go over all the different ways to help tackle all symptoms, not just genitourinary symptoms, but also hot flashes, mood swings, lack of sleep, insomnia, all of those things as well in this class. And so her and I tackle it together because we both have different specialties.
Yep.
And she addresses more of the hormones issues there. But it's a fantastic class. She has an in-body scanner, which for women going through menopause, it's really important working on our skeletal body mass.
Okay.
And strengthening. So she brings that in, and women can also, if they want to pay a little bit extra, they can do this scan to see what their body fat percentage is, skeletal body mass, all of that, which is a really cool option. And then at our clinic, we're actually creating a menopause program. So very specific, detailed, like a checklist that we go through with all our patients that are in this menopause
Okay.
time frame.
Oh, yeah?
So if people are interested in the class, it is $25, which is
Okay.
a great deal. So you don't have to just do all your
Yeah, it's not
Googling
bad. Yeah.
on Facebook. It is a 2-hour class. It's 5:30 to 7:30 in the evening, and coming up on March 26th here in Effingham, and then May 1st will be in KZ. And you can go to Facebook if you are on Facebook to register. There is a link that will bring you to our Effingham Pelvic Health website where you can just register online, and then you'll get an intake form where you fill out your questions that you have.
Oh, very nice.
All women coming to these classes have their own questions they want answered.
Oh, I'm sure they
So
do.
fill that
Sure.
out. Tiffany and I go over that. Or you can just call our office to register, and that number is 217-705-5077. And again, it is a $25 class, but you'll walk away with so much information to help with this transition in life and to help your husband too, so he doesn't think you're going through a midlife crisis.
That's right. It's like you're going through a crisis, but it'd be nice to take care of that for them and make things a little easier.
A lot of marriages struggle at this time too, especially if they're having urinary symptoms, so lack of sexual intimacy with their spouse, or the mood swings, lack of sleep. People struggle in their jobs during this time frame too. So
Yep.
just so much information and ways women can benefit.
Hey,
And-
and that second meeting class is at KZ Coffee Company. So I'm assuming, they may be able to get some liquid refreshments there. 5:30 to 7:30, maybe they want to hold off on the coffee.
I would recommend
get decaf.
Yes, decaf, which is still an irritant, but
Yes,
it's better
an
than
irritant.
regular.
Yeah, they have other choices there too.
Yes.
Very interesting, no doubt about it. So, looks like you got your work cut out for you here. Busy time, no doubt about you. Getting ready to have a baby of your own, and that's pretty awesome.
Yes.
So,
Yes.
coming soon.
Coming soon in
Why not,
May.
right?
Hopefully not any earlier.
That's right. You got other things to do. What? Anyway, always a pleasure having you here. Everybody get on there and get registered for those classes before
Yeah.
they're sold out. And we'll talk to you again real soon.
Awesome. Thank you guys.
All right, BD, talk to you on the drive home tonight.